obviously puts you at the front line. I'd like to take the police services assessment of your duties during lockdown so far.
Thank you, Gipsy. So basically ours is about enforcement. And so we're looking at it in terms of the level of compliance. And we are satisfied with the level of compliance, although we would have wished for 100% compliance. But so far, so good. A lot of people, or majority of the people, decided to stay home or decided to freeze their movement so that the actions planned by government for the containment of the COVID-19 disease would be carried on. And so we would say that the level of compliance was high, making our enforcement for the lockdown period successful.
Okay, so here on Frontline, usually what we do is I will put the spotlight on the people who are doing the work. So we've done the assessment, but we focus more on the personalized story and how it felt for people who are at the front line. So do tell us, are there any special personalized stories that you can share with us?
I think it was an experience for every officer who participated in this exercise. You know, we had to work around the clock 24/7. So at every point in time, you have police officers joining our counterpart military officers on the roads, sometimes at places that people do not really go often, like particularly at the blocks and at the unapproved routes to and from some of these cities like Kaswa. There are several unapproved routes from Kaswa or exiting Kaswa into Accra or to the main central region and all. So it was an interesting exercise. For some, it was exciting. For some, it was more challenging than ordinarily sitting in the office and doing office work, because we had to pull officers from all over. Most officers are given almost the same training of being on the road. And so it wasn't just about the officers who are always on the road. So but it was an exercise worthwhile. We have all learned different lessons. And whenever we are supposed to do this, it will not be new. We have been performing these exercises, or we have been enforcing or performing search operations, not only in Ghana. We've been doing that elsewhere as well. And so this was not new, but it was still interesting for us.
Interesting for you. And that's where I come to. You mentioned that it's been challenged, you know, there were challenges, you have learned the lessons. I'd love for you to throw a bit of light on those for us. So some of the issues that came up during lockdown really had to do with PPEs, for example, for the police, food, money, etc. Let's start with the PPE. The fact that you're interacting with people, sometimes I get stopped, they ask me for my ID card, they'll hold the ID card. The fact that you're interacting with people, PPEs was important. But we realized that at some point, some of the officers did not have PPEs. What sort of lessons have you learned from this experience? Share that part of the PPE bit with us as well.
Okay, so what I will say is that I do know that every officer was supplied with PPE, but it wasn't easy for all officers to wear the PPEs. Even as of now, it's not easy to wear your mask all the time when you are outside of your house. And so some prefer to put it in their pockets and all. But we all had to come to the realization that if we needed to protect ourselves and protect our families and protect everybody else in Ghana, and that those we are protected by way of enforcement, then we needed to wear our mask all the time. And for those who were engaging with their hands, like taking identity documents, like searching, sometimes we needed to be in gloves. Right now, what the police administration has done, and this came through the government, is to give us reusable masks so that they can be washed and ironed and reused. So for the officers who engaged in the front line, I do know that the distribution has started, and the IGP has promised that it will cover almost every officer in the country as the day go by.
Speaking
so in terms of PPE,
right,
that is what I would say.
Speaking of officers who were at the front lines, we understand that a number of them have been in quarantine. Give us more of that, please.
I am not sure the word to use is that they have been in quarantine. The Inspector General of Police has instructed medical officers who are at the police hospital, who from day one have been working with the Ghana Health Service on this COVID safety, to take samples of officers for testing. And that program will be rolled eventually for almost every officer to be tested if that is possible. So that is what is being done. But the officers are encouraged to follow all the necessary hygiene protocols, including being in self-isolation if possible. So we are all mandated to wear masks. And so when you go to any police facility, I expect you to see everybody in mask.
Okay.
We are all expected to keep washing our hands rigorously as taught. We are all encouraged to sanitize, and so there are automatic dispensing hand sanitizers around.
So just a quick clarification. You indicated that
courtesy of donations.
You indicated that medical officers. You indicated that medical officers of the police hospital have had their samples taken. Is it only those at the police hospital, or is this a police service?
What I said is that medical officers at the police hospital have been instructed to take samples of the frontline officers for testing by the required laboratories, because they work with the Ghana Health Service. And these medical officers have been part of the coronavirus arrangements by the Ghana Health Service from day one.
Sorry, I missed that.
That is what I mean.
Sorry, I missed that. I just needed to get that clarification. And so how many people are we looking at in this exercise?
We are looking at all the officers who took part in the lockdown enforcement of restrictions on movement in Greater Accra, Greater Kumasi, Tema, and Kaswa. And that would be about 10,000 officers.
Okay, 10,000 officers. And whilst their samples are being taken, are they required to be at work, or are they required to stay at home and wait for their results?
Commanders have been instructed to make all arrangements possible, including self-isolation where necessary.
So do you decide to come to work, or you can stay at home?
For now, officers who took part in the enforcement have even been given days off to rest. And I do know that the police hospital started taking samples, I think, yesterday.
Okay.
So depending on what arrangements or what peculiarity stations may have, they will come to headquarters if it means that they will need all the officers to stay home. But all officers have been mandated. In fact, it is compulsory for all of us to wear masks and to continue to follow the necessary hygienic protocols.
Okay. And just to be clear, before we wrap up, this is not because anybody is showing signs or symptoms, or not because anybody there are suspicions or anything, just because of the work done from the lockdown. We've had
not at all. Nobody is showing signs. You would know that even the officers who came into contact with foreigners or people from other nationalities who came through the various borders and who were quarantined were tested, and their results came out positive. So
negative or positive?
Any officer is showing signs, but as a precautionary measure.
Hold on, you just said that their result tested positive. I just want to be sure. Were you trying to say negative or positive?
Negative. Right. Their results came out negative.
Okay, because you said positive, I had to be sure. Okay.
All right, thank you.
So we're wrapping up, but I'd love for you to tell me your own experience. How has it been for you? I mean, there are times we'll call you when you'll be on the road. You say you're tired, you haven't slept. Maybe you can share a bit of that. Our viewers would love to hear, get personal with you.
No, I mean, it's been an interesting exercise. Let's not forget that we are not done with enforcing Operation COVID Safety.
Okay.
Yes, there is the ban on movement in Accra, in Kumasi, Tema, and Kaswa has been lifted, but we are still enforcing the operation, and we are enforcing the ban on public gathering. We are enforcing the closure of schools and the borders. We are enforcing the social distancing rule. And so far, so good. It's been a lot of lessons. It's been a lot of engagement, not only in the media space, but with identifiable groups and agencies to ensure that all comply.
Okay.
And so it is an exciting experience, and it continues to be exciting. It's not over until it is over. Perhaps I should say that it won't be over until there is a zero record of COVID-19 in Ghana.
Hopefully so. I'm sure you have you've carefully swept my personal question, but that's okay. We'll get. I'm sure there will be a chance where we get more of the personal experiences. Thank you so much, Superintendent Abaye, for your time this afternoon and for sharing with us what the situation is at the police service. So on this segment, we celebrate our frontline workers. Today, we focused on the police service. Of course, we've also been telling you stories about PPEs in hospitals. Well, the hospital administrator for Mamobi General Hospital, Helen Tete, is debunking claims that staff are buying face masks to work as opposed to the hospital having to provide for them for free to manage the COVID-19. In an interview with JoyNews, Madam Tete said their PPEs, including face masks, are made available to staff on a regular basis and can be verified by their stores. She, however, admits that they have limited resources and would need more from the government to combat the disease. Her response came after some media outlets reported that their staff were purchasing their own face masks and other PPEs.